Why does post-bronchodilator matter in COPD gold staging? Imagine trying to figure out if someone truly has a chronic lung problem or if their breathing issues are just temporary. That's where post-bronchodilator testing comes into play. When doctors diagnose chronic obstructive pulmonary disease, or COPD, they need to see how much the lungs can really do. They use a test called spirometry, which measures how much air you can force out in 1 second and how your airways are functioning. But here's the key. They do this test twice. First, before giving any medication, and then after administering a bronchodilator, which is a medication that relaxes the muscles around your airways. Why is this second test so important? Well, COPD is marked by airflow limitation that stays even after using a bronchodilator. If your airways open up significantly after the medication, it suggests your breathing problems might be due to other conditions like asthma, which are reversible. But if your airflow doesn't improve much, it confirms that your airflow limitation is persistent, which is a hallmark of COPD. This helps doctors avoid misdiagnosing someone with COPD when they might actually have a reversible condition. The gold staging system, which is used worldwide to classify COPD severity, depends heavily on these post-bronchodilator results. It looks at how much your lung function is reduced after the medication. The critical number here is the ratio of the amount of air you can force out in 1 second to the total air you exhale. If this ratio is less than 0.7 after using the bronchodilator, it confirms airflow limitation consistent with COPD. Without this step, there's a risk of diagnosing COPD in people whose lung function might improve with medication, leading to unnecessary treatments. Once the airflow limitation is confirmed, the severity is graded based on how much your lung function is reduced. For example, if your post-bronchodilator FEV1, that's the forced expiratory volume in 1 second, is between 50 and 79% of what's predicted for your age and size, you're classified as having moderate COPD. If it's less than 30%, that indicates very severe disease. This staging helps doctors decide on the best treatment plan and gives an idea of how the disease might progress. In practice, this means that health professionals always perform post-bronchodilator spirometry to confirm COPD diagnosis and determine its stage. This approach reduces errors, ensures consistent diagnosis, and guides appropriate treatment. It also prevents unnecessary medication for those whose lung function improves after bronchodilator use, avoiding potential side effects. For patients and caregivers, understanding why post-bronchodilator testing is so important can clarify why these tests are repeated and why treatment plans might change based on the results. It's about making sure the diagnosis is accurate and that the management plan is tailored to the real severity of the disease. In the end, post-bronchodilator spirometry is the most reliable way to measure persistent airflow limitation. It helps distinguish COPD from other conditions, ensures proper staging, and supports effective, personalized care. That's why it plays such a vital role in the gold staging system and in understanding COPD overall.